Going once, going twice. I'm not sure if anyone shared anything in the chat. I'll open that up. Um, but if we have no other memorable moments, we can continue. Thank you all for sharing.
Thank you, Zerxazer. And I just want to welcome everyone to today's meeting. My name is Phyllis Slade Martin, and I'm, as Zerxazer mentioned earlier, I am the co-chair of our Health Equity Work Group meeting, and we are happy to see so many of you join us today. Um, and what am I doing next? So we just want to welcome you and welcome you back to a new year. Always look at these new years as our opportunity for a fresh start. And so we just want to welcome you back with us today. I'm on the phone, and so hopefully you can hear me clearly as we are on the phone. I'm trying to get to a bigger screen. Uh, and so one of the things that we I'll mention just in this welcome and introductions is that we really want to, as we look at our goals and objectives, we really want to tie every agenda into our express goals and objectives. And so what you will see is we will talk each week and just share each week so that as we have new people coming in with us periodically, we're going to share our vision. And so we have um, we'll have a visual of our vision so that that is shared and understood about what the work group is all about. So we will have that up each week. And so as you can see, when we look at the health equity work group, our vision is that Prince George's County will be that place, will be a place where everyone has equitable access to achieve their full health and wellness potential, regardless of race, color, religion, country of origin, immigration status, class, age, disability, sexual orientation, gender identity, or health literacy skills. And we say this because often, we'll throw around the language health equity, and health equity. And so this hopefully will help you answer, so why are we meeting? Why are we here? What is this about? And so everything we do will be driven by this mission. So I'll just give a quick recap of the meeting that we had previously. And reflected in the goals that we're going to cover are the details that we work with related to the strategic planning. So many of you know those who are returning and engaging, and those who are new. We had a lot of discussions in the last year, about our what is it that we want to focus on? What are our priorities? Why should we be doing what we're doing? What is effective as we look at that vision related to health equity? So in our last meeting, we really spent some concentrated time looking at our strategic plan related to our goals and objectives for this year. And so that discussion and previous discussions informed what you received in terms of that draft of our goals and objectives. The other big thing we worked on is, as you know, is the Health Equity Champions program. And we have been very fortunate to have collaboration and partnership with the University of Maryland's Terrapin think tank, students who are going to present today, and also with Dr. Howard Latouche and I believe Dr. Yeager. So we are, really excited about this. And this discussion that we will have today is a continuation of what we discussed in the previous meeting. Yay. So it is my pleasure, and Kim, jump in if you want to uh, mention anything additional, to introduce Yiting Lin from the University of Maryland Terrapin think tank, who's going to go over and talk with us about the Health Equity Champions lesson plans. Thank you.
And let me know if you would like me to pass the screen sharing, Yatin.
Okay, great. Yeah, thank you everyone for the introduction. Just some background on me. Right now, I am a rising senior at the University of Maryland, and I have been part of Terrapin Think Tank since last year, and I've been working with Isha and Daniel, who some of you may already have met from previous meetings. And since they graduated last year, now me and Ethan, who joined the last Health Equity Champion meeting, he and I are both going to be the directors for Terrapin Think Tank this year. And we're really happy to be the directors, and then we have 3 fellows working with us. And we're really excited to carry forward this project with the work group and further our progress on these modules. But just to give you some background, so over this summer, we have gone through the Health Equity Champion curriculum objectives to brainstorm and research various ideas for how to structure our lesson plans. And we took that information that we brainstormed and any resources that we found to create specific lesson plans for each of the modules. And this information can be found in the Google Drive that was sent out in the email announcements. So we'd be happy to hear any feedback or any suggestions on how to further forward and then push forward our progress on these modules. But throughout our brainstorming progress, we looked at various activities that we can use to try to teach this curriculum and how to efficiently communicate what we want to the learners. So we brainstormed various case studies, like videos, websites. We looked at various websites, and then different interactive activities on how to teach every module. And within the lesson plans, you'll see that we structured it where we broke up the individual components of each module and then have different activities under them. So I can share my screen and show you an example of one of our curriculums. Let's see. Okay. So as an example, in the Google Drive that was sent out for in the meeting invites, so we have each of these modules. So for example, this is module 1, and we structured it where we have a time, an agenda item, and then notes and activity and any talking points on this in this column. So if we go through here, so we broke it down by how much estimated time each section will take, and then the main objective for each section, and then in a general overview of what we are going to talk about. So for example, for this, we have an explanation on what we are going to talk about, and then a summary of an example, and then each of these modules also have associated slides with them. So here we can see, you can go through the slides and see the curriculum for these modules as well. But as we scroll through, for example, this is a case study that we thought of for learners to better apply the knowledge that they learn throughout the course and make it more interactive for the learners. And then, for example, like here, here is the resource. So for example, all of these resources have links. So you can directly click on the link and then it will bring you to this website that we are referring to. So for example, like walk through this website and then ask the audience these questions. So these are like examples of some of the modules that we thought of and activities for each of the modules. So yeah, our fellows and us, we've been working through the curriculum throughout the summer and thinking about different activities to put in these modules. So we'd be very happy to continue to work on this and throughout this fall semester, especially because school starts August 26th for us. So we're planning to meet with the fellows of the Terrapin Think Tank again late August, and then we're hoping to continue to work on the modules and further tailor our curriculum to how our learners are going to receive it.
Thank you so much. This is really exciting.
Yeah, of course.
Did anyone have any questions?
I just wanted to add my thank you as well. I looked through the modules and they are quite thorough, particularly when I looked at module 2. I'm like, wow, this is quite detailed. So we appreciate the work that you've done.
Of course. Thank you.
So we want to
Yeah, I
hear
would like
from
to.
the rest of the group.
Yeah, I'd like to add a big and hearty thanks as well, because the information that's been gathered here and put together is, like Phyllis had indicated, very thorough, and at a level where learners at various levels would be able to grasp, which is important. I did have one question pertaining to the modules. Is there a component for pre and post evaluation or assessment?
Yes, so right now we haven't thought of like a post assessment way to like assess the learners, but we can definitely work on that. Yeah, that can definitely be something that we think about. But we do have some for some of the modules, we have like resources that learners can take home with them or like keep for reference. So we were wondering, will this will this curriculum be delivered like online through an online format or maybe in person or maybe like synchronous Zoom? So just depending on the format, we definitely have ways where we can leave resources behind for the learners so they can reference it for themselves.
Great, thank you.
Yeah, but
I have
one
a question.
Oh, yes.
I was just opening it to seeing if there were other questions or questions in general on the Health Equity Champions program.
Yeah, from our side, we were wondering if there is a certain course delivery format we're thinking about, whether that be like in person or online.
I have thoughts, but I'd love to hear other members of the work group think in terms of as you look at us trying to build this group of advocates across the county. What are your thoughts on whether we go virtual platform, live virtual, whether we have courses that people can take independently online, or whether we have in person. So what any thoughts on that from the group?
I have a thought. Oh, go ahead.
Go ahead. You got here first. I'm so late.
I had a thought about, well, two thoughts really, and no good answer. One is that you probably would get more participation from a certain group if you did it online, but there is a group that's really important to reach out to that you're not going to get with an online. So it would be best to offer it as a hybrid, although it makes it a little more complicated, both with the technology, but also with, you know, I think we may identify target groups that you would really want to be in person for, and you'd really want to make the location as convenient as possible.
Well, I'm so sorry. It was so late, so I didn't really see the presentation. Yinting, I'm so sorry. I'm Sriana Lialis Barker, and I'm doing too many things at the same time, not healthy. But here I am. I just want to share that we've been very successful with some hybrid systems for group and training. I know this is not easy, but I think some university setting has capacity already. And anyhow, also we've been really feeling the community is missing the human connection on some level, and to kind of enchant people to do the work that is pretty much like an activism, right? The human connections make a difference now. So that like the silence on the in those environment and everything like this, I think I would say that too. There is something about kind of activating people to do things, and I think the curriculum is a little bit like to become a champion is activating people to do something beyond their initial understanding of health. I would think a hybrid system would be good. So we would troubleshoot the transportation or access for some people, right? Some people really don't have the money sometimes, or some people live so far that. But those who can get together, and also in our experience now, the hybrid, the people online who see the vibration of the people in person also motivates them, right? Because anyhow, I just want to say that to add what Sharon just said.
Okay, great. Yeah, that's great to know. And right now, a lot of our activities can be converted to like either online or in person. So we were hoping to like ask this so we know how to tailor our curriculum more if it is online or in person. But a lot of our activities right now are interactive. So for example, like the teacher, we have teacher like what they ask the students or activities to do with the students. So yeah, we have both types of activities. So we were wondering like if there's one type that we should focus on more. But yeah, that's great to know. So as we like look forward to further advancing our curriculum, we can see and pick different activities that can fit both formats.
I think this is so important. It's interesting. The last quarterly PGHAC quarterly meeting, that was a hybrid situation, and there were people that I spoke to. I attended in person. There were people that I spoke to who attended virtually who felt very engaged with the meeting. And so I was going to ask Kim if you could give perspectives of what you walked away with from that kind of example that we had in that last meeting.
Sure. So I felt like that meeting, I did feel like I was missing some of the connection with the people who were online, having the availability of people in the room. I was a little bit worried that all of the discussions were not that they couldn't be heard completely because we had some engagement from the participants, but a lot of it was, the speaker was the main focus. So I think that was helpful. I do think that, with the technology, if we have the available technology, we can make sure that the engagement is there. I think another big thing is just making sure that someone is monitoring any chat or any raised hands online so that they have the opportunity to participate as well with the people that are in the room. And I've been to a few meetings that try to do hybrid where if you're online, you can't hear anything. So I think that technology is so critical for the success of a hybrid meeting.
And I want to I think what Sharon and Suyana said is so important in terms of the in-person engagement and the idea that if we are going to be inclusive, right, that we have to consider things like transportation, location, time, etc. If we're going to be inclusive and say there is this value in that in-person engagement, which is something I enjoyed a great deal about being in person, because it is those times during breaks or at the end of the meeting that there is a lot of engagement too. So it sounds like we're, suggesting both and.
Okay, great to know. And then a follow-up on that. So for these courses, if they are delivered in person, how long are you expecting it to take for each module? So we can monitor our time when we design or further try to break everything down. Is there usually a time frame for these courses?
I think they vary. I mean, I certainly this is just my thought, and so everyone please jump in. But my thought is, if you're asking me to drive out to a meeting, then I'm going to expect that meeting is at least 45 minutes or an hour long. And that's just because of me driving out in person. I think certainly there are things that can be done anywhere from 30 minutes to 90 minutes. After 90 minutes may be pushing it. I don't know what other people's thoughts are, but I do think there's a value in, sometimes brevity is wonderful. So sometimes if it's like a 30-minute session that I can attend, great. But what are some other thoughts?
I echo some of the sentiment that's already shared in the chat. Typically with online, you do start losing people if it's over 1.5 to 2 hours. So I would recommend, if it's hybrid, that you take that into account for those who are not in person.
Okay, great to know. Yeah, right now I think our average time frame is around 1.5 hours for each module, but we can definitely shorten that or lengthen that, or if there's any adjustments we need to make. But yeah, we right now we have 4 modules, so maybe we can think about this later on how we're going to administer this course, whether it be one module every week, or how often they come in, or how often we have these courses. But the time frame is good to know, so we can keep that in mind. So I think 1 to 1.5 hours seems a good time.
Yeah, and I absolutely agree that going over an hour and a half is tough.
Yeah.
Unless you are at a retreat, if there is a kickoff and there's food and etc., that may be one thing. But there's some really good comments, I think, for us in general in the chat. Zerxazer.
Yeah, I'm not sure why I'm labeled MG when my initials are XK. I can change that. My comment, I guess, would be, if we're considering, I guess we're considering this as live trainings, but then the other side to this would be recorded training sessions, and taking that into account, how long. Obviously, those who have access to a recorded session, have the opportunity to take breaks if needed. But just kind of wanted to also throw that out there, that we're considering these live, in-person, hybrid, but then, are we also considering recorded online sessions as well? And what that would look like.
I apologize since I also was very late, but I can share that the state, I know they've been doing training for community health workers, and what they do is and this might be too much for us to do, but they offer like a week-long in-person training, and then for anyone who misses it or misses any day or can't, attend for some reason, then the next week they do an online version of the same training that you can attend.
Mm-hmm. Yeah, so having it tape, yeah. And that's where I was thinking that if you had the online self, I think that's what you're saying, Xerxes, so the online self-paced courses
Correct. Yeah.
would be maybe 30 minutes to 45 minutes, Now, Yi Ting, is there someone who I'm assuming at the university that we could connect to if we decided to do sort of an online curriculum?
Are you talking about administering it through or with the university, or?
Well, it would be about eventually we are looking at partnering with a university entity to begin with. But I'm just saying in terms of, and this may not be something that we can answer here, but just the idea of looking at having that curriculum available as Xerxes is describing, one in which you can do self-paced, individualized instruction.
Yeah, I think that'd be great if we can try to connect University of Maryland with this as well. I can definitely talk to the dean, so Dr. Ziegler and Dr. LH and our team to see what they suggest. But yeah, I'll definitely mention it. I think that's a great idea.
Yeah. Yeah, and we have some preliminary agreement with them about this partnership. So yeah, that would be great.
Okay, great.
Any other comments?
Oh. One more question I had from my side is there a slide template that we can use? So right now we have already made PowerPoints for all the modules, but I know it'd be better if we structure it and have a streamlined outline and a template that we can work off of from. So is there one template that we already have that we can use for all of our PowerPoints?
So we, of course, have a internal health department slide template, but far as a coalition specific template, it's a little bit less structured right now. So we could either work together with our communications team to create something, or we could provide the appropriate branding to add to your existing slides. So we're pretty flexible with that.
Okay, that's great. Okay, yeah, I think if there is maybe like a template that we can use, that'd be very helpful for us, so we can transfer everything onto one streamlined template.
Absolutely. I can work on that.
Okay, great. Thank you.
Any other questions or comments? Well, thank you. That was very helpful. And, please, if anyone has other thoughts or comments, just send it to us, Kim. You can send directly to Kim or certainly if there are questions about the lesson plans, we can then compile those and get that information to your team and the group.
Yes. Yeah, thank you, everyone. In terms of next steps for us, is there something specific you'd like us to work on for the fall semester?
I think for now, and we'll discuss this more, but I think for now, if we can, iron out the lesson plans and some of the general questions that would have been in that comprehensive email that we sent before. So that would have been with the previous group, just taking a look at that, and you will be following up to finalize the partnerships and working with the program as well. Kim?
I know previously we had some subject matter experts really focused on each of the 4 modules. I'm wondering if it's possible that we can kind of task out a review of the lesson plan so that everyone can really direct any feedback that they have and divide and conquer instead of asking everybody to take on every single one of the modules.
Yeah, I think that is certainly something that we can do is to reach out. Now, we had subgroups before, but some of this let's kind of based on our discussions today, let's kind of parse that out some more in the planning meetings and figure out how we can move forward with some of this. But I think certainly getting specific feedback, because so much we had many work groups that worked on the 4 module units, and that's what we sent to the Terrapin think tank. So now we need to look at what we have and kind of, if you have thoughts on other next steps, that would be great. But some of what we have to do is go on and formalize that relationship.
I wanted to say I agree with Kim that we should parse it out, because I get the feeling that the students would like to complete this and move on to another project, or that they have to have some closure in terms of their responsibility. And it would be nice if we could give that to them sooner rather than later.
Yeah, I'm not in disagreement at all. I'm just, I think I agree. So I'm not disagreeing. I think that there's some things we need to kind of go back and look at. But I definitely agree that when we're at that place, that's kind of what we need to do. So definitely in agreement with that, because the part of the reason I said is because Yiting, it's what when we look back at some of the original, what we kind of focused on is even bigger than the lesson plans, right? So there are aspects that are kind of outlined in that original document that's bigger than the lesson plans. Just in order to give you a coherent answer, I think we need to kind of go back and look at some of that, and so that we can be coherent with the work group as well. But I definitely agree that we need to. I agree. I won't belabor it. Sorry.
Okay, yeah, thank you for letting us know. Yeah, thank you so much. And we're grateful to be able to work with all of you on this.
Okay. I hope you can stay with us. I think we're gonna focus on our goals, looking at our working through our goals now. Is that our next agenda item? Okay. So, what is exciting is, one, I want to thank everyone for your participation in the development and the thinking through related to the proposed goals for the next few years. And so we definitely want your thoughts. So what we did was we took um, your suggestions and feedback and work to shape these into goals. And so I want to give just a shout out to Zerxazer and to Kim for as we work to some this summer to kind of shape these goals and put them together. So nothing is in stone, and we can kind of this is our opportunity to work through finalizing. And if there's something you feel that do we want to do this now, or if there's something else that should be added, let's hear what your thoughts are. And Kim, who did a lot of work in helping to shape the goals, Kim, do you have any thoughts as we're going into the discussion about the goals?
My main thoughts are, as we start diving into each of the individual strategies under these goals, is as much feedback as we can get it with people around some of the specific action steps or who they think might be involved. I think that's the most valuable if we can just kind of start honing in some of those details. And then for everyone to just consider that this work plan is expected to be a 3-year work plan. So we do have a lot of things that we would like to address, but we want to make it realistic for our time frame. And with our community health improvement plan, we do plan to revisit where things are every year, so we can make adjustments based on what changes happen or anything that might impact this time frame. So we kind of just want to create a solid draft. But I will leave it to you, Dr. Slade Martin, to go over the details.
Okay, and thank you, Kim. And what we came up with are these overarching goals. So there were 2 overarching goals that seem to be the themes repeated as we looked at our discussions from last year. The other thing is we kind of put in some completion dates, and though any of this can be modified, so we want to really welcome and encourage your thoughts on your specific or your general thoughts on the goals. So my goal is to kind of give that overview and to have you to give your thoughts on how we can begin to implement. So the first couple slides, and then we'll get into some things that we, again, pulled from those previous engagements and activities and discussions about action steps. So here we have goal 1, to promote and advocate for health equity for all individuals within Prince George's. And the general objectives related to that were by 2026 to enhance county leadership and stakeholder awareness and preparedness to endorse policies targeting the fundamental drivers of health inequities. So that kind of gets into that advocacy and policy kind of focus. And then to increase the reach and effectiveness of public health messaging to county residents. And then goal 2, to foster inclusive healthcare opportunities and representation in Prince George's County and the Health Equity Workgroup. And so, in other words, wanting to really, as we have talked, to really expand and ensure that we have representation of different groups, grassroots, health professionals, agencies, that we have that representation within this the work that we're doing, and we're encouraging that throughout the county. And so then with the goal 2.1 is cultivating these collaborative networks. And so to identify and establish partnerships with 12 key stakeholder or organizations who are engaged in work to address the social determinants of health. And I think more specifically related to looking at the vision and the goals and groups that can tie in to the vision and goals. So for example, I won't get into the examples. Let me stop myself. Okay. And then 2.2, the diverse workforce enhancement. So to enhance a diverse workforce in Prince George's County healthcare roles, including clinical, administrative, and research positions. And so as we go, if you have comments, please jump in. So as we look at goal 1, again, drawing from those previous discussions, to promote and advocate for health equity for all individuals within Prince George's County. And under objective 1.1 that I mentioned before, we begin to kind of break this down into strategies. And so under this first goal and objective, then we talk about the Health Equity Champions curriculum. And to look at the curriculum to serve providers, leaders, and residents in Prince George's County. And then strategy 1.12, to look at advocacy and policy influence and to serve in an advisory role to the Board of Health by providing feedback on proposed or past legislation and programs. So those are kind of those broad goals. And then to, as we look at the action, you can go to the next one, Kim. So we talked about strategy. I won't read all of them, but so here we have some action steps. And so I want to pause and just give you all an opportunity to react to, respond to, suggest thoughts on those 2 primary goals and some of the overarching strategies that we have looked that we looked at. Any thoughts or feedback on that? Those. Are we going in the right direction? Are we, as you reflect on what we talked about previously, what are your reactions to these stated goals?
And I think as we start to look at these action steps, especially having just, discussed where the lesson plans are and had that really great interactive discussion around the implementation of this program, just specific, getting more into the specifics of who would be the appropriate audience to do a focus group on this content and really start a pilot program. Does anyone have thoughts on how we want to go about implementing that pilot and who would be our best first trial people?
So we have a quiet, we have a kind of quiet group tonight, but even if you can share some of your thoughts in the chat, that would be helpful.
Well, and I think this is Christine. Sorry, I also joined late, so I may have missed
Happy
Some
to see you, Christine.
how you doing? May have missed some context, but I think it's important to not just focus on those in the known and accessible fields like public health, who may have had some exposure to this, but also um, just lay residents who may have interest in um, making their community healthier, but they may not participate in this role. So I don't, in terms of getting that out publicly, I mean, that I am not a great strategist, but I do think it's important that we start thinking about um, others outside of public health and the healthcare field.
Now, Christine, that is the, if, and correct me if anyone hears differently, that is much of the intent of the Health Equity Champions curriculum. And so I'm wondering if there are, if there are thoughts on if we need to reword anything to ensure that that is understood, because your point is so well taken. And so do we need to reword anything that we
I don't know if it needs to be reworded, but I mean, if I'm in transportation, I may not necessarily think, I may not see myself. So I think the messaging surrounding that, how we're promoting it, has to, and I don't know, marketing is not my strong point, but with that, would you see yourself, if I'm not in this field already, I don't have health somewhere in my sector, would I see myself in this? I think that just goes into like what we need to do to recruit. Hmm. I know I'm actually just pondering your question. I'm wondering.
Well, this is good. I mean, I think this gives us something to work with. Sir Sacer, thank you, Christine. Sir Sacer says one thing I'm not sure if it has been mentioned, but is to think about not only the focus group participants, but the focus group instructors as well. Who do we anticipate to teach the curriculum? And so some of that, I think, is going to be determined by the partner organization that we kind of hand this over to. But it's still an important question that, we would have recommendations for. So if we look at these action steps, one of the action steps is to, as Kim was saying, is to complete focus groups on curriculum content. And so, Christine, for example, with that, we really want to make sure we are in the community, getting community feedback from lay people in the community with some of these focus groups. And so what are some thoughts on timeline for that? Does anyone have thoughts on timeline and who might take responsibility for that? I can throw out some thoughts. So, if we try to complete, is it reasonable to say that we would try to complete these focus groups by December of this year? Would anyone object to that? By say we complete, and then that would be HEW and Terrapin think tank, maybe, or University of Maryland.
I had a question.
Sharon?
I'm just kind of thinking about who is going to conduct the focus groups. I mean, Kim, are you going to do this all by yourself? Probably not. That maybe what we do is bundle the focus group into the task we ask the designated partner to do.
Interesting.
Because I don't see any, unless we have
Good afternoon.
a work group members who have the ability and our time to do this. I don't see it getting done, and I think it is an important component before we actually implement.
Very important point. I think we need to take note, definitely take note of that. That's a really good way of bringing in those partners. Yeah.
And I agree with what Kim put in the chat is, do we have any resources? Because I'm not sure if anybody would volunteer to do this without getting paid for doing it. And that's just sort of the reality of life right now.
Yeah. And I would also say definitely like residents will expect to be paid for a focus group. And just in my humble opinion, the county is not the ones to administer the focus group if there's going to be funding, because it is really hard for us to pay residents directly. So it would be much better for it to be whoever the other, if it's the partner organization or whoever else we can get. We have a lot of difficulty paying individual people.
This is really interesting because the whole thing about paid focus group members, I didn't even think about the pay, but there have been people, I think about the recent focus group that was conducted. They got paid a nice amount of money for participating. So that's something else we need to consider. Okay. Any other thoughts on as we look at any of these action steps, supporting designated partner and conducting the pilot program? And that basically is saying whoever we finalize, which hopefully with Dr. Latouche's group, as potential, we would still provide, we would determine to what degree we want to engage. Will we be as advisory groups, advisory members, and then will we structure that? And so that may be one that's farther out as we're looking at that implementation date, I think by December 24th. So that may be somewhere like the fall of 2024. Is that reasonable, given that we're looking at implementation, that whoever takes on the Health Equity Champions program would actually implement? But we have to take all of these things that you've said into consideration. And then we have, I think, the evaluating pilot program and make updates and edits. Again, we would probably need to have that discussion with the partners. I want to pause and just ask, as we're looking at these action steps, what we had discussed just briefly in some of our last meetings was the idea of basically once we kind of shape and get our thoughts down related to this program, the idea is realistically, we're not in a position to implement. We are, developing, and then the idea would be once we select and come into agreement with the people who will essentially implement the program, and hopefully that's through the University of Maryland, then we would want still some relationship with the project. So can we just take a minute to discuss what you think that relationship should be, what that should look like once we hand over the program? Any thoughts on that?
I have a few thoughts on that. One is that if people are trained and then they don't use what they learned, that's an issue. So I see our role as creating opportunities for graduates to use their skills, and whether that be setting up meetings with individual council members or having them, getting them on an agenda with the health and public safety and education subcommittee, or that we come up with a few strategies and things that we would like for them to do ahead of time, so they know that the training's worthwhile, we know their skill is used, and they have an opportunity to make an impact.
Mm-hmm. Mm-hmm. Important, yeah.
I think that's great, and I think that ties in directly with the next strategy around just us being advocates and serving and talking to the Board of Health around that implementation. So I like the way that flows.
And that connects really well with, when we talk about that relationship with the liaison to the board, and that liaison assisting us and being in front of or making that connection, having that two-way street that's happened, not just a consultant that's coming to give us updates, but us having that opportunity to engage as well. So good. Other thoughts? Other thoughts on this? Thank you, Suyana. Okay.
So I was just going to put down as our action items, since it seems like some of our immediate need is really defining this partnership, is scheduling a follow-up with Dr. Latouche Howard and Dr. Ziegler. And that's really our number one action item, is just getting that scheduled and on the books, and finding out what their role would be, or if we need to explore other partners.
Yeah, and I think that when we talk about October 2023, that number 2 action step is definitely that priority. And I think if we can get that done no later than October 2023, that would be great. Yeah. Okay, let's as time is kind of running through, what I will ask everyone to do, please take a minute to look at some of these. If you have action steps you think that apply to some of these, if you have different takes on any of these goals, any thoughts on, whether we're kind of following or applying the things that we talked about in the spring, however, whatever revisions, modifications you have, please get them to us, ideally by when? Before the September 12th meeting. So maybe around the 5th or 6th, whatever the end of that previous week is, so that we can incorporate your thoughts in the information that we'll share with the larger group at the quarterly meeting. This one is again, this captures what we talked about a good deal before. So the action step would be to invite and encourage the designated county council liaison to provide monthly updates. So we did find out we have a new person. I don't know if Anya's on. I don't think Anya is on, but Dr. Blocker will be the new consultant for the Board of Health, the liaison that will work with us. I did send a last minute note, I confess, to Dr. Blocker and invited I'm not sure the availability, but invited them to join us in a planning meeting and at our monthly meeting. So hopefully we will have all of that ironed out for our September meeting. But we do want to welcome Dr. Blocker. And hopefully they will be able to present at our September meeting. And as this kind of alludes to, we're looking at this, that again, that the representative is not just sharing announcements with us, but that we have more of an engaged interaction. And then we're able to accomplish some of those things that Sharon suggested. Karen says, Karen has to jump off as well. Thank you, Karen. And Karen, if you can give us, if any of you can give us feedback on this stuff, it would be fantastic. So Kim, I have some thoughts on dates. We can put some dates in and send it back out. And then let's go to the next one. And so I'll pause and give everyone time to kind of look through these and any thoughts you have on the communication framework to, again, the idea is to broaden our reach messages that increase public health resilience and address emerging public health issues. So much of this was born out of what we saw with that ad hoc vaccine work group and how people really came together and how it was very critical as we were looking at COVID-19 and the vaccines and how it was effective in ensuring that there was communication that affected diverse populations. Any thoughts on that? We have a hand raised. I can't
It's
exactly.
Christine. It's Christine. Yeah, quickly, I'm looking at the action steps. What is the communications map? Is it the, like, something that comes out of that compilation of all that came in the step before, or is it something else that's been defined somewhere like outside of that?
Thanks, Christine. Yeah, that was my thought, is that we kind of had this ongoing plan within COVID of how to get messaging out around, any new populations that were available for vaccines. So we developed these partnerships with libraries and schools and all across the board, and we really just had a plan to push it out as to those partners as soon as we got new information. So it's taking that and then building in any new partnerships that we identify through this group to create this kind of network where we can do this distribution of information. So that's my thought of the map.
Got it.
Does that answer your question, Christine?
Yes, it does. I was just I figured that was the case, but I just wanted to clarify. And is the map different than the plan? So that's referenced in the step below.
So I just wanted to add that maybe we should just change the language, and instead of saying communications map, say a distribution network. And also, I think if you do a distribution network, we have to identify who triggers the network. What would be the trigger to have this group under its name blast out a communication?
Mhm. These are good, good questions, good feedback. Other thoughts on this?
Well, I just want to be conscious too that we're not overstepping into, I'm glad Caitlin's on the line, overstepping into what the public health department is supposed to be doing. Right? We need to be aligned.
Caitlin, can you talk on this a little bit, knowing I don't know if you not to put you on the spot, Caitlin, but when you reflect back on looking at the ad hoc committee and how that group kind of came together, and I think Dr. Bauer was a part of that as well, and had actually this thought for our group as we had some of our discussions in our last meeting. So if you have thoughts on how we can kind of accomplish or work with those existing things, because I think that is such an important. Sharon, you're on a roll today. Thank you. But how how that ties in. So
Yeah, so I mean, of course, we're doing a big after action report for the response overall. I think it makes perfect sense for the coalition to do sort of like an after action type situation on its own. Interventions, I mean, I'm sure that'll be part of our overall after action report, but we probably won't be going into detail on, what information was shared at those meetings and how we could improve the use of our existing networks through the coalition to push out information quickly if there were a future public health emergency. I think that makes a lot of sense, and that would be really useful, honestly, to the health department if we could receive, whatever we end up putting together, if there's like a communications plan that we end up developing, and then we want to share that with the health department and say, here's how you could use the coalition in an emergency. That would be, I'm sure, immensely useful to FEB. So that's the Public Health Emergency Preparedness Program. So I think, Sharon, you're completely right, but we can also kind of work together. Look, two after actions is better than one. So
and
sounds
maybe
good.
we use more lay kind of language. Maybe it is that we use more lay language, because what I think we're effectively suggesting is that we want to make sure that, again, talking about health equity, we want to make sure that on that ground level, on that grassroots level, how people in this coalition can come together as advocates. And that ties into when we look at perhaps part of lesson plans with the Health Equity Champions program, that we have some kind of at least mention on when there is an emergency, how can we activate that and get the word out to people in the community or people working on a grassroots level in communities. So yeah, cool.
And I'll also say, I think and Kim will laugh because I think we're both getting flashbacks, but there was it wasn't necessarily like known or established the channel through which the coalition could provide input or feedback or disseminate information within an emergency response in the county. And so there's a lot of like me and Kim pushing information back and forth, and Allison, and it kind of being wonky. And then we set up this side group and everybody's like, what group? So there wasn't necessarily a good alignment there, where I think we could, if we really thought that through and proposed a clearer role, we could get that incorporated into plans. And then, plans are as good as they are, but we could at least have like a framework for what that interaction might look like in the future.
Yay.
Yeah, one of the things I thought about the ad hoc COVID group was that it reached a little deeper into the community, and it also reached more deeply into organizations to hit the people who are on the ground. And I think that, sometimes you can send out the public health communique and it sits in some executive director's box like mine and doesn't necessarily move very far beyond that. But what you really want to do is hit those people on the ground, not even an emergency, but things like flu season's coming up, these are at-risk populations. Make sure, your mom has a vaccine, that kind of stuff.
Yeah. And it's true. And, when we think about we just did a outreach strategy for a project. And when we think about how can we tap into that kind of thing, because people are reaching people at the food distributions, at the produce distributions, and looking at from that kind of grassroots level. So however we shape that, Kim, you work your magic as you know how to kind of put those thoughts together. But yeah. Let's go to, as we're at 4:51, I want to pause and just ask you all to please look at the other goals and strategies. I want to give Zerksazer time to talk about, I think, another important agenda item before we close out. So I'll just ask that you please send Kim your thoughts, send us your thoughts, and we can continue to refine the goals and objectives. Thank you all for that really good discussion. Good stuff. Zerksazer.
So she's still on pickup, so I can jump in here. So again, we're short on time, so we might not be able to dive too much into the full discussion here, but as part of our collaborative network, we really want to start engaging new partners, partners who represent community members that we might not be reaching, so that we can include them in the communication network, and just make sure that we're being mindful of all of our different community members. So what we want to do is start really just getting ideas for what organizations should we begin reaching out to and engaging more within the health equity work group. So if anyone has immediate ideas, I can certainly begin to add them to this list. I did put the International Mayan League as an organization that I feel like we need to engage. They worked very closely with us through the COVID response and vaccinations in Langley Park, specifically for our Mayan residents. And so if people start to think about any organizations that they feel like would be valuable to come and present, to talk about the population that they're representing, and to make sure that we're mindful of ways to interact with that population better. So feel free to either add them in the chat, raise your hand, or you can, of course, send them to us after the meeting. And our thoughts are that we will begin reaching out to those organizations and have them present one representation per month.
Caitlin mentioned CASA. I always mention the African Women's Cancer Awareness Association. We have also Community Ministry of Prince George's County. They are faith-based. They can help us reach some of the faith-based.
Could you say that one again, Phyllis?
You can put CMPGC, and they are faith-based. Caitlin also mentioned Maryland Latinos Unidos, if I'm pronouncing that correctly. Sharon says LGBTQ youth organizations.
And thanks specifically, Sharon. Thanks for everyone for their feedback. Specifically, Sharon, we realized that our community health assessment does not address LGBTQ at all. And it's a huge gap. So really appreciate that.
Wow. Caitlin also mentioned, is this a person, Walter Samba?
Yeah.
I'm sorry. Walter suggests.
No, that's me. I suggested.
Okay.
I'm just giving the contact information for Walter. I'll give it for CM.
Cool. Awesome. Thank you. Other groups that we should be sure. Christine, what are some of your thoughts on other groups we want to bring in?
To that are geared to specific populations.
Or interest, or as we look at the goals that we're seeking to focus on, as we're looking at our goals, the groups that we can come in that can Shanika says aging seniors, ADA populations, really important. Yeah, good stuff. And so there are various civic associations. I often also mention the 202 Coalition, having someone from the 202 Coalition. Good stuff. Caitlin has a nice list. The ARC of Prince George's County. Awesome. The Langley Park Civic Association. The unhoused. In fact, Kim has a group connected to the unhoused, I think. IPV. Reentry programs. Oh, this is good. There's a local NAMI. Is it NAMI, NAMI, or NAMD? Looking at mental health. I know there's a Prince George's office, Prince George's County office.
Yeah, is that JP? JT? I can't remember the initials. Well, shame on me. I'll find it.
Good stuff. It's La Clinica. Is that, I don't know if that's a group. That's the group that I think Suyana works with, and then we have Mary's House.
Those are FQHCs.
Oh, okay.
Which certainly have an understanding of what's going on,
Mm-hmm.
but are a little busy.
Yeah.
Well, I think this is a great start. I want to be mindful of everybody's time, and I can pull everything from the chat that you've all provided. So thank you so much.
This is awesome. Thank you.
And we can continue. Oh no, we can continue to kind of brainstorm over time as well if we don't identify or pull from all 12 right away. But it looks like we have a lot of groups that we can start reaching out to.
I just want to thank everyone for your participation and your great feedback and comments today. This was really all that we had hoped for. We actually are right at 5, but if there are any announcements that anyone wants to make real quickly, please share those announcements. Kim mentioned the quarterly meeting and registration for the quarterly meeting, which is on September 12th. September 12th. Any other announcements that anyone wants to make? Okay, well, if that is everything, we want to again just thank you. And listen, special thank you to Kim for just doing really, we're just very happy for with all the work that is taking place. So thank you all and have a great week. We appreciate it. We appreciate you. Thank you.
Thanks, everybody.
Thank you.
Bye-bye.